Hi, I'm Dr. Vonda Wright, and this is Hot for Your Health. Some people say that we're living in a broken healthcare system. How do we find the best doctors? Once we find them, how do we get access to them? And what in the world do we do with finding insurance online? In this episode of Hot for Your Health, I've assembled an amazing panel who will help weed through these really tough questions on how you can get the best access to healthcare.
So that became my full-time specialty 11 years ago when I became a medical editor at WebMD. And it was what bridged me into that job is when I was in full-time clinical practice as a family doctor. I had the traditional kind where it was very pressed for time. It was a huge practice. I took over for a retiring doctor who had a very large practice of elderly patients. And so a lot of my patients had several medical conditions that needed to be covered quite frequently. But then I also had a younger population coming in as well. And what I realized is that in the time constraints of the current medical system, there just wasn't enough time to talk about everything and talk about everything as comprehensively as I knew needed to be done in these visits. So what I did is I created a library of information that I could give my patients to take home with them so that when they left and tried to remember, okay, what was it actually that we said? How long am I going to need to take this new medication? Where was I supposed to look for additional information? When was I supposed to come back? That they would have a sheet of information to consult. So, and I would individualize it by I had a whole file cabinet and I would individualize it with little notes. And so at WebMD, I really clued into the fact that this could be something that could help on a larger level, that working with health information companies who are producing that kind of information on a more global scale, there really needed to be attention to accuracy, the up-to-date factor, and the understandable factor. Because health information is great if you understand what the heck it's saying and also how it applies to you. So that's what I've been doing for the last 11 years. And actually this topic is very near and dear to my heart. I wrote a book in 2011 called The New Prescription: How to Get the Best Healthcare in a Broken System, which is basically what I would tell you if we were sitting down and having a conversation one-on-one and we were talking about the frustrations with the current healthcare system. And my feeling is I'm frustrated too. I also feel very powerless and helpless with it too. And it's a huge system, a huge machine, and I view it much the same way as politics. Like, we can get out there and get our voice heard and try to band together and really create change on that level. But really the power is what we can do on an individual level and what we can do with our immediate circle of influence by changing the way that we approach it and our everyday lifestyle decisions. So,
love it.
That's
what we're here for.
What we're here for. And I have a daughter and I have a son, as previously mentioned. So, all right. So the current healthcare system, what's up with it? Dr. Kevin, tell us your viewpoint of how does this current healthcare system work or not work?
Well, and I see it from the perspective of taking care of people when they are in the most need in the ER. And one of the issues for me, one of the tremendous issues is always, people would come in and they'd have these problems. They'd have them for a while. I'd say, well, why are you waiting so long? Why was it an emergency at 2 o'clock in the morning? Or, why did you come, when you've had this for a while and whatever the problem was. And they say, well, I don't have insurance, or my insurance I have this high deductible plan, and I don't want to come in until I really needed to come in, et cetera. I couldn't find a primary care doctor, people weren't taking my insurance, or this kind of thing. So there's so many problems. And so what people don't know where to go until it's, they're really uncomfortable, and it's like, wow. And so, I said, people would always ask me as a doctor, they'd say, well, what do you think of this idea of, Obamacare or universal health care or that kind of thing? And I said, well, if you have 50 million people that don't have insurance, don't we need to do something? Don't we need to fix something or, look at it a different way? Because it's not working the way it is right now. And as hospitals buy practices, because as many of you know, hospitals are saying, well, I need to buy this office practice so they can feed patients into my, coronary care unit or into my, or surgery or whatever it may be. Well, the danger in that, and what my fellow physicians are telling me is that, unfortunately now we have people telling us, you've got to see people every 8 minutes, or you got to see people, because if you're not seeing enough patients, you get called in and said, something wrong here. But I'm giving you good quality care, isn't that important? Yeah, but you still got to see 8 people every 8 minutes. And so there's a lot of things that I think are wrong with the system, and we need to correct it. So.
Michelle, you have a personal story about experiencing the current healthcare system and approaching it in a way that's outside the box. Could you tell us about that?
Sure. I totally agree with what you're saying, Dr. Kevin, because, in my own experience of getting sick and not being able to get well and spending a year trying to navigate this system that, I consider myself to be, I'm pretty smart, not, book smart necessarily, but I've got enough smarts to know when something's going on. And I think when you're in the throes of being sick like I was, you don't really know what to do, right? Because you have nobody to advocate on your behalf, which is what happened to me. And so I fell victim to this system that was supposed to be taking care of me and actually did the reverse for me. And because I didn't know how to navigate through this, and again, I was sick at the time, it became very difficult to figure out how to get well. So I was sick for, I was given a hysterectomy for one reason when in fact the two were not they were not connected. So you looked at that and you go, I always say know your body, ladies, and know your body parts, because here I am suffering from a colon disorder, which is called diverticulitis, and I'm 40 some years old, 42 years old, and all of a sudden they say, we'll give you a hysterectomy and that'll fix the problem. Well, those organs, I don't have to stand up and show you, but they don't work. So, but the point to all this is, number one, no second opinion. I could have had one, right? I didn't, because I didn't really think about, when you're in the throes of being sick, you don't think about all the things that you should, right? How to advocate for yourself. And I think to your point too, Kevin, is that, it takes 17 seconds before you're interrupted by a doctor, on average, for a woman to be interrupted. So you have 17 seconds to get your message out, and you better be quick when you say it, because then you're going to be interrupted and game over, right? Because you've got 8 minutes.
The federal health insurance marketplace is now open. That means you're free to shop for the health plan that's right for you. UPMC Health Plan has some of the most affordable plans on the marketplace. And they all give you full in-network access to UPMC, plus other doctors and hospitals in your community. Visit upmchealthplan.com or call 1-855-297-UPMC to learn why so many people have chosen UPMC Health Plan. Enroll today.
So it's so broken that unless we take it back ourselves and we start pushing back on that very system, find doctors like yourselves who are willing to do things differently, which is difficult today, because what are we faced with? We're faced with, you have to do this in this way, this is how the system's been set up, and we're not going to change it. So your wellness exam is a wellness exam. Don't talk to me about the fact that you have something wrong with you. I'm not kidding you, because this is a wellness exam. So today, what I just heard before I came here is that, if you're sick and you go in for your wellness appointment, if you tell the doctor there's something wrong with you, they're not going to get paid. That's crazy. It's craziness, but this is the kind of stuff that we're seeing. So that's why I decided to do something different and start Empower, because if we don't start taking care of ourselves and advocating on our own behalf, and also to your earlier point too, Cindy, is working together in our communities to change this. What's going to happen to our kids? It's bad enough of what's happening to us and our aging parents. What's going to happen to our children if we continue to let this system stay the way it is? And we deserve, I will say this, we deserve to have great health care. We pay for it. Right. Mm-hmm. Amen. That's why I say fire your doctor. You're paying for that service. You don't like them, they're out. It's just that simple. So you can see I'm not passionate about this at all.
Well, and you've both mentioned that third-party interference has really been an eroding factor in the physician-patient relationship, so that it's the system that's broken, and it's still a human issue. Every part of this involves humans, and humans who are vulnerable. So it's very emotionally charged because of that, and so it's a very, very, very complicated place to be. But you also mentioned that you don't have to just accept that. So yes, the system is malfunctioning currently, and we don't know how to predict how it's going to evolve from here. But understanding more about the inner workings of where we are right now will help empower you to approach it differently. So it may mean, Dr. Kevin, you've mentioned the aspect of concierge medicine. Can you tell us a little bit more about what that is?
Yeah, I think one of the biggest movements today is this idea of the concierge medicine. And concierge medicine simply means that you pay a certain fee up front, and then as part of that guarantee, that fee that you pay, you get access 24/7 to your doctors, and you're guaranteed a certain amount of time. The problem, it's a great concept, and but the problem is who can afford it, because it is much more expensive on average than traditional care that you pay a certain small copay, but at the same time, the people who have it are, very much, they love it because it's a two-tier system again. So how do we kind of level the playing field for people who can't do that kind of thing? And that's part of the problem, I think.
And one rising aspect of that is it may get to a point where certain concierge practices are actually more affordable than the deductibles on some of the insurance plans. Yeah. So it's just something to be aware of, that some doctors are transitioning into that model, and the membership fees could be very reasonable depending on where you are and who's available. And Michelle, you also mentioned something else in that about the value of a second opinion. And that when you are in a particularly vulnerable situation of being diagnosed with or misdiagnosed with something, it becomes even more emotionally charged, and people tend to not hear much of what's being said. Yes. So a very small percentage of what is spoken in an exam room is remembered correctly after the fact by everybody. This is not just an individual thing where you think, oh, I probably should have just remembered what they said. There's something wrong with me that now I don't remember what they said, or when they were saying it, I didn't understand what they were saying to me. This must just be me. I'm embarrassed about that, so I'm not gonna say anything about that. I'm not gonna speak up because I should have been following along well. And what you need to know is that this is for everybody. Everybody feels the same way, that they may not be understanding a large majority of what the health professional is saying, and then when they get out of the room, particularly if it's something about a potentially scary diagnosis or a misdiagnosis, you're really not going to remember it because of all of the emotions and the chemicals that are flooding through your body. It affects how you're able to process and remember that information. So it's really critical to make sure you understand it and reach out for a second opinion, or reach out for somebody to help you make sure that you understand it. So along those lines, our next topic is the current healthcare system. So we know kind of what we're dealing with. What can it do for us? And on the other hand, what can't it do for us? Dr. Kevin?
Well, let me start out with one of the statistics that I think is interesting. You hear politicians all the time saying we have the best healthcare system in the world. We are the best at healthcare. Well, when you look at the data from the World Health Organization, Commonwealth Fund, and other places, our healthcare system is ranked anywhere from 25 to 33rd in the world in comparison to countries we think, well, why are they ahead of us? Because we do a lousy job of sort of saying, infant care. We do a lousy job of maternal care in terms of prior to pregnancy, end of life issues, all this sort of thing. So that I think when you look at the system, look at it and be skeptical a little bit and say, well, is this really true? What they're saying. I don't think we do have the best healthcare. We pay the most compared to anybody else in the world. And yet, when you look at the satisfaction surveys from people from other countries, well, of course, we're very good at highly skilled technical care. We have the great MRIs, or we have very technical surgeons that are really good at doing very risky procedures, for instance. But when it comes to everyday primary care, we do not a very, very good job. And if you look what's coming down the road, most physicians coming out of medical schools today are not going into primary care, but are going into specialty practices, which means it's going to be harder for us to have people finding primary care doctors, or finding people, as if you're my age, 70 and above, then what you find is that you're finding a geriatrician, somebody who specializes in aging related factors. So these are some of the things that are scary for me about the system. What's positive to me about the system is that when you find a good doctor, when you find someone, I tell people all the time, let your pocketbook do the walking for you. In other words, if your doctor's not listening to you, or you're not getting the care you need, speak up and say, I am leaving your practice because I'm going to find someone else because of blah, blah, blah. And either they may apologize and change it, but again, they're financially dependent on you. And if enough people do the walking, then things are going to improve over time. So I think that's a big power that you have, we underestimate. And you probably know, since you're the social media person and I'm not, but talk about the idea of how social media can play a role in terms of shaping doctors' behaviors.
Thank you so much for joining me this week for this episode of Hot for Your Health. You are a powerful force in your own health, and I'm excited that you took the time this Thursday to learn more from our nation's authorities in health. I hope that you subscribe so that you don't miss one single episode. Join us next week for Hot for Your Health, and for more information, find it at womenshealthconversations.com.